And I'm a member of the board of Dharma Voices for Animals and been part of DVA for, as I said to folks at the very beginning, for 7 or 8 years now, and honored to be able to give this talk as part of LMB. So we'll in a minute or two, I'll go through sort of the key areas that I'll talk about. And I think it's fair to say debunking myths and thriving on a plant-based diet. We'll go through several subject areas and a lot about the health aspects of plant-based nutrition and the things to be aware of and pay attention to. So I'm a pediatrician. Um, I have a number of affiliations now for purposes of this talk. So I'm part of Dharma Voices for Animals, and that's presumably the reason why I was invited to give this talk. I have helped to found a new charity called Nutrition for Families, which supports pediatricians, other pediatric clinicians, and families in a healthy, plant-forward nutrition for infants, children, adolescents. I've been part of Physicians Association for Nutrition for, well, that's probably also 7 or 8 or 9 years. It's a global NGO. Doesn't do program work in the U.S., although we have some presence in the U.S. It's in 10 countries right now, several countries in Europe, India, South Africa, Israel, Brazil, and growing. And we, as you can tell by the name of the charity, we support um, physicians, medical students, other clinicians, especially dietitians, of course, policymakers and the public in benefits and aspects of plant-based nutrition. I am a pediatrician. I've done some primary care work, a lot of pediatric emergency medicine work as well. Practiced in Buffalo, New York. As I mentioned earlier, I grew up in Brooklyn, New York. I've done a lot of public health work, work with health plans, hospitals, a lot of work with impoverished populations, access to health care. Some of my work's been in, my clinical care has been in pediatrics, but some of the public health and hospital health plan work has been with children, much of it with adults, of course. I've been a number of roles with many charities over the years. You can see the gray hairs. So I have a long bio. I'm almost done with it. But medical, health charities, several animal advocacy and animal protection charities, some humanitarian charities as well. And for the last 7, 8, 9 years, I spent most of my time working on healthy nutrition. And that's what we're here to talk about today. So just to outline the talk, so a few words about One Health, a little bit about lifestyle medicine, blue zones. I won't talk much about climate and diet since others have talked about that, but just to touch on it, public health and eating animals. Bolded or highlighted here. The keynote really is power of nutrition, is healthy plant-based nutrition. So that'll be the focus. Some myths about vegan diets and some comments about micro and macronutrients, vitamins, minerals, and the macronutrients like protein. As a pediatrician, I'll say a few words about children and a few words about docs and other clinicians. So that's the talk, and here we go. So One Health is a concept that's gotten some airtime the last 10 years or so, and makes the point that One Health recognizes that the health of people of our species is obviously entirely connected to the health of animals, to plants as well, of course, and our shared environment. So we, without getting deeply philosophical here, we humans, or many humans, have this sort of view of being the different from and separate from nature and the top of the food chain, and obviously we're part of the world, like all other sentient beings, and of course nature itself, and our health depends upon the health of the rest of the ecosystem, of course. So lifestyle medicine. So a couple of busy. I have a few busy slides, not too many. And so I'm a member of the American College of Lifestyle Medicine, which is a professional association that supports physicians of different medical specialties in lifestyle medicine. And so the first slide, two on lifestyle medicine. There are 6 main pillars of lifestyle medicine. It's a little wordy here, but I highlighted or put in green, I guess, sort of kind of for veggies. The first one, which is, all 6 are described as equally important. Nutrition is probably first amongst equals. So whole food plant predominant eating pattern. And this is about human health. This is, we're obviously people not eating animals protects animals from suffering and from slaughter, and protects the environment. The focus of today's talk is principally about the health of humans, not entirely, but principally. So hopeful plant-based diet emphasizes, as everybody knows, consumption of primarily, not exclusively, primarily minimally processed veggies, fruits, whole grains, legumes, nuts, and seeds. It focuses on nutrient-dense foods that are high in fiber. Fiber is super crazy important. You only can get fiber from plant products, not from animals. Animal products. I hate that term, but have no fiber. And whole food plant-based diet is high in antioxidants, which reduces inflammation, reduces the risk of cancer and other inflammatory diseases. And a whole food plant-based diet avoids, for the most part, processed food, added sugars, unhealthy fats, and animal products. Physical activity, well, everybody knows that, but we know we don't always do it. So both aerobic and resistance activities is good for cardiovascular health, for bone health, for mood and emotion, for general well-being, and of course for weight management. Sleep, easier said than done, and but getting around 8 hours of sleep a night is really important for health. We all have, some of us have more challenge than others based, perhaps upon family constellation or work, or some sleep difficulties, but just identifying that sleep is key to health as well. But the other three attributes of lifestyle medicine, so stress management and meditation is we all know is a useful, has many attributes, and for Buddhists can say much more about the criticality and centrality of meditation than I can or I will here. From a human health point of view, meditation has been shown to improve health as part of stress management. Social connections, and last and not least, avoiding risky substances, illegal drugs, alcohol, and tobacco, of course, and all the rest. And we all know that, and that is blessedly as well part of Buddhist faith, and just the website for ACLM, the American College of Lifestyle Medicine. All right, so blue zones. So there are 5 blue zones in the world. One in the U.S., Loma Linda, California, so not super far from where you are, and that's based principally on the Seventh-day Adventist population that centers around Loma Linda. Nicosia, Costa Rica, Sardinia, Icaria, one of the Greek islands, and Okinawa, Japan. And so what are blue zones? Well, here you are. Blue zones are these really confined or smallish areas where there's a huge difference in health, high longevity, greater than 10 years. The average lifespan is more than 10 years compared to longer, compared to other people in those nearby communities in those countries. So obviously not comparing to the world, but comparing people in Icaria, Greece to the other parts of Greece. Greater than 10-year expected life expectancy. And from a public health statistical point of view, obviously from an individual point of view, that's huge. From a public health point of view, most interventions, a 10-year increase in average longevity is crazy huge. Blue zones have far and away many more centenarians. People live to be 100 years or more. The lowest mortality of people in middle ages, and lower rates of Alzheimer's and other forms of dementia. These blue zones are geographically separated, have strikingly similar lifestyle behaviors. Community, active exercise and walking during the day, not just going to the gym for half an hour, but walking up steps and hills and having exercise being part of one's life. Community, caring for others, and diet. The diets are, while somewhat different based upon the geography, are all and not vegan. Some people are vegan in blue zones, but almost everyone is is plant forward, 85, 90, 95% plant-based. Some people may eat a little bit of fish, Mediterranean-ish sort of diets. Um, um, but a plant forward, a principally plant-based diet is central to blue zones. So these really are, I mean, it's wonderful to see, except for the rest of us that don't live in blue zones. But these are um, uh, sort of kind of natural experiments. Um, so a few words about Loma Linda and talking to folks in California. So the Seventh-day Adventist, part of their faith tradition is is a healthy lifestyle. About half of Adventists um, um, eat a vegetarian or vegan diet, and many of the others eat very little meat and much less processed food. Um, Substances, alcohol, illegal drugs, tobacco, not part of is prescribed as well. This was a huge, actually several huge population study. I mean, for those of us that have done some clinical research, a population study, 100,000 people is unbelievably huge. Just a few of the, so natural experiment, if you will, a few of the findings within the Adventist population. So again, this is already a very healthy population. And about half of the Adventists are maybe a quarter are vegan, a quarter are vegetarian, and some of those are close to vegan, and the other half are omnivorous, although eat a healthier diet than the average American diet, um, which is sometimes referred to as the standard American diet or SAD. So no matter the cholesterol level, diabetes status, blood pressure level, or metabolism, within this population of healthy people, vegetarians have lower health risks. Data shows a progressive weight increase amongst the Adventists from going from a vegan diet to a vegetarian to a non-vegetarian diet. Um, Cholesterol levels, diabetes, high blood pressure, metabolic syndrome. Metabolic syndrome is sort of kind of the precursor for type 2 diabetes. It's overweight, especially central around the waist, and the beginning of metabolic measures in the bloodstream, tracking towards type 2 diabetes. All the same trend. The closer one is to being vegan, again, in this healthy population, the lower the health risk. For type 2 diabetes, vegans and vegetarians um, in this population had half the diabetes as non-vegetarians. And even with well-done study controls, so people of the same economic status, people with otherwise similar controlled lifestyle factors, those folks that ate a vegetarian or vegan diet had half as much type 2 diabetes. So very striking findings. All right, just a word about climate and diet. I mean, there are books, white papers, there are experts. I am not a climatologist. I'm a physician and a public health expert. Um, just one slide. This just there's many of these, but it shows it's a bar graph, and so from left to right, you can see um, the first. So the y-axis is pounds of CO2 per serving, per typical serving of any of these food items, and then you can see that beef, eating cows, eating cattle is the biggest offender for greenhouse gas emissions. Cheese comes next, then eating pigs, poultry, eggs, milk. So the first 6 bars are all about eating animals or animal secretions. And then you see this dramatic drop off, right? And these are just some examples of plant-based foods: rice, legumes, carrots, potatoes. It's orders of magnitude difference. So here's a question that comes up a lot is around diet and climate: is what percent of greenhouse gas emissions, CO2, methane, all the rest, comes from animal agriculture? Uh, And so there clearly is an effect. It's substantial. Um, it's that famous saying about there's um, 3 kinds of data: lies, damn lies, and statistics. And so um, there's a wide diversity or divergence of different studies reporting the impact of animal agriculture as compared to eating plants. on greenhouse gas emissions. UNFAO found a 14.5% of all of the greenhouse gas emissions on the planet, about 15%, according to the UN, based on eating animals. World Watch, this is an older study. World Watch says more than half, 51%. That's they didn't make anything up, but it was a study done by advocates, and so it's probably overcalled some. New York Times did a really, really, really well done review, found 14.5 to 18%, which I think is about right. The EPA during Trump 45 found 10%. A well-done study in sustainability, obviously a journal, a peer-reviewed journal about sustainability, found 16.5%. So really it's someplace in the mid to high teens compared to, so really a significant decrease if people ate plants instead of animals. And then just for a sort of funsies sake here, a study out of Texas A&M, out of their ag department, they found that animal agriculture has a 3% impact on greenhouse gas emissions. And so, it's, I mean, they didn't make stuff up, but they definitely cherry picked the data for their purposes. Okay, public health and animal agriculture. We'll talk more about individual health, each of our own health, but just to say a few words here. So antimicrobial resistance, you probably all know something about that. That many antibiotics no longer work to kill lots of different bacteria. It's an ongoing arms race since we began using antimicrobials in a broad scale kind of way back in the 1940s, and the penicillins that killed many microbes like staph way back then. They don't work for a lot of those anymore because the bacteria become resistant. And of course, from an evolutionary point of view, they're they multiply and divide every 20 minutes to an hour or so, they can, and there's huge numbers, so they can very, very, very quickly do selection around drug resistance. So some people find this shocking or striking, but over 70% of all antibiotics used in the United States are used on factory farms. So, and so these are, I mean, all the animals there are sick because the conditions are despicable and unhealthy. But the reason why antibiotics are given to, animals are crowded into spaces that are horrible, and of course spread disease, and they're made to grow very, very quickly and then be slaughtered. And so by dumping a lot of antibiotics into pigs, chicken, cattle, other animals at factory farms, they grow faster, and they and fewer die, from infectious disease. I'm not saying that 70% of all antimicrobial resistance comes from factory farms. That's a much more complicated question. It's probably somewhat less. But 70% of all antibiotics used in this country are used on factory farms. And so that's not talking about veterinary medicine, where veterinarians, like human physicians, prescribe antibiotics individually for purpose. This is about the wholesale use in factory farms. Foodborne illnesses, well, clearly, I mean, there's a number of different microbes, you know them all. Salmonella especially comes from, there's been many salmonella mini epidemics from eating chicken, and when chicken flesh is measured, upon slaughter, and then in food stores and so on, the chicken meat always has salmonella, or I shouldn't say always, but frequently has salmonella. And the FDA's rules aren't about having no salmonella; it's about just having no more than a certain number per gram. Many other bacteria, staph, Campylobacter, Yersinia, and so on, come from foodborne illnesses, typically from eating animals. Sometimes, like E. coli, there are dangerous foodborne illness spread by eating produce, and the reason why, so that's real. The reason why is because the great majority of produce produced in um, um, an effective, assertive um, vegetable farming uses manure, uses cattle manure, and so the E. coli is is in the cropland from the manure. So it all comes from animals. Um, but and so again, most food were enlist with eating animals, some from eating produce as well. Um, also, our species eating animals has been, and we're a few years past the pandemic, although COVID is now endemic. Um, so I couldn't, by the way, pandemic. So many of the viruses that have jumped from um, animals to humans have been via factory farming. SARS-1 is in East Asia. Many of the flu illnesses, and of course, COVID is more complicated and probably from a laboratory that's still open for question, but probably from a lab in China. Wet markets also are a place where pandemics can be created by the spread of bacteria or virus from animal host to human host. And when the microbes jump from host species to host species, they mutate, and they when they get to our species, act differently and more aggressively in many ways. Deforestation, and also I would add, around, I'm not sure what market is quite the right term, but um, many scientists think that HIV um, uh, came to our species um, by the slaughter of primates in Africa for human consumption. Um, Deforestation also is another form of um, pandemic spread as our species reduces forests, reduces all the wildlife areas. Um, Humans and animals come in closer contact, um, and the various diseases that spread. Sometimes, for example, plague um, can go from deer to a tick on mice or rats to humans. And so as we reduce and destroy um, forest um, and live closer to animals and reduce their habitat, we increase the chances of pandemic spread as well. Michael Greger, who's a super expert, you may know of him, and he's the author of How Not to Die, How Not to Diet, How Not to Age, some other books as well. He's a very impressive guy. And How to Survive a Pandemic. And so one of his and a good source of information as well. Nutrition facts listed there. Um, 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 and so one of Michael's quotes is, "If you actually want to create global pandemics, then build factory farms." And he gave a lecture on that subject probably 15 or 18 years ago, well before COVID. So he's been expert in this area for quite a while. Okay, moving along. So the heart or the core of today's discussion, power of nutrition. So this is a busy slide. Speakers are always told never apologize for your slides. You shouldn't have slides that are too busy. And this one probably qualifies. This is from CDC, Center for Disease Control. And so it just lists for the last couple of years, I showed 2 years because I just wanted to show COVID on the bottom, which obviously has, dropped a lot from 22 to 23. And of course, if we were looking at um, 20 or 21, it would be off the graph. But to nutrition. So heart disease, diet has a huge influence on heart disease. Diet has a major influence on many cancers. Not an unintentional injury is accidental trauma, so it excludes homicide and suicide. So that's not a diet-related cause of death. Stroke is really part of cardiovascular disease, and so that also has a major as we eat poor diets and get cholesterol and plaque in our coronary arteries, it's in arteries throughout our body, including in the arteries in our head, and leading cause of stroke. Um, Lung disease is not so diet related. Alzheimer's and other dementias, there's some diet relationship for sure, because people that eat plant-based diets have much less dementia than people that don't. Type 2 diabetes, two kinds of diabetes. Type 1 is an autoimmune disease, much more common in young children. Of course, it lasts for a lifetime. Type 2 is highly diet related, as you probably know, and is highly correlated with overweight and obesity. Kidney disease has a multiplicity of causes, high blood pressure being a major one, and diet, of course, and salt and being, a major cause of high blood pressure. Cirrhosis has many causes, and alcohol, of course, being a big one. Fatty liver, which is a major cause of liver disease, is diet related as well. So when you look at this bar graph, again, this is deaths in the U.S. Not all, but most deaths come from diseases that have a high correlation with poor diet. All right, so just to go from a too busy slide to a super simple one, but I just figured, just for the record. So whole food plant-based diet is composed, of fruits, vegetables, nuts and seeds, whole grains, legumes, beans, lentils, and peas, and so that's what we're here to talk about. So getting back to both disease prevention and mitigation. So disease prevention means not getting it at all, of course, and mitigation means if you have one of these diseases, to reduce and sometimes eliminate the disease. So we've talked about a lot of this already. So I won't repeat it, except to say type 2 diabetes is particularly interesting in the sense that there's been a number of really well done studies showing that people who eat a standard awful diet and are overweight or obese and have type 2 diabetes, and which is a major cause of all sorts of different kinds of morbidity. So not a good disease to have, and premature death. That by eating a whole food plant-based diet, really an entirely healthy vegan diet, that many people come off insulin, many people come off of oral medications. Some people have no evidence of type 2 at all. And it happens quickly. It's a remarkable change. Some cancers have a correlation with diet. Not surprisingly, many of the GI tract cancers do, and breast and prostate as well. There's more and more evidence that dementia has a correlation with poor diet, autoimmune diseases like lupus and some of the others. Rheumatoid arthritis, which is also an autoimmune disease, has been well shown to be much less common in people that eat a whole food plant-based predominant diet. Osteoarthritis, which is the more common arthritis, which comes from overuse and comes from obesity and comes from just getting old and genetics. There's now a couple of studies, including my organization, the Physicians Association for Nutrition, did a study in the Netherlands recently showing that whole food plant-based diet has a major effect on mitigating osteoarthritis, which was surprising and dramatic and wonderful to see. Mentioned fatty liver. Okay, so what about plant-based meats? Beyond Impossible, Tofurkey, all the rest. So there was, so there was a recent, 3 years ago, a study done at Stanford. And so what it did is it took people that eat a standard American diet, and it did what in epidemiologic terms is called a case control study. So folks were randomized. Of course, they were volunteers. They were randomized, and otherwise they ate what they normally eat. So these were not people eating a whole food plant-based diet. They were eating whatever they eat. And for 8 weeks, half of the folks ate plant-based meats from Beyond Meat, which is a fairly healthy plant-based meat product and becoming healthier still. And the other 50% of the participants just ate what they usually eat, which is regular meat. And then because it's a case control, so they were switched. and so they were sort of kind of their own control. The two groups switched, and so during 8 weeks, which is quick, there would TMAO is a sort of a research marker for cardiac inflammatory disease, and so it's higher in people that have much more risk for coronary artery disease. And so TMAO decreased LDL. That's bad. That's bad fat, bad cholesterol, um, and, um, and dropped as well, and weight dropped too. Um, what was um, what was interesting, so that happened quickly. It was interesting that the group that was randomized first to plant-based meat, they kept much of the reduction in TMAO, again, a research marker of cardiac inflammation, when they were switched to regular meat for some period of time. So there was something that lasted when they went back to eating meat. And so there's conjecture, it's not proven, that maybe there was a change in the microbiome that improved their anti-inflammatory and perhaps cardiac health, that lasted beyond the time that they ate plant-based meats. So some evidence that plant-based meats are healthier than meat. So question comes up all the time. So when in some of the circles I travel in, some of the adherents, the true believers, both when I use the term lay people, I mean non-clinical people, and some physicians, dietitians as well, will sort of the people that are committed to a whole food plant-based diet will talk about prepared vegan foods, plant-based meats, especially. They'll call them transition foods, which I find is unhelpful to get more and more people to eat fewer animals. Because it implies, well, it's it's not great, but it's not quite as bad. So the question is, though, from a human health point of view, what about plant-based meats? They in general are likely healthier than meat, and then it all depends. It depends on the product. Red meat and processed meat and cured meat is really, really, really unhealthy. There's more increasing evidence that chicken as well is significantly unhealthy. Um, um, some of the plant-based meat companies, and I've engaged some of the people at Beyond, like I mentioned, are working harder and harder to have much less saturated fat, much less salt in their products, and so they're somewhat processed, but not super crazy ultra processed. The market, and I would mention also sort of a little beyond nutrition, more from the marketing point of view, the some of the companies now are trying not to compete, not to say that we're a meat substitute, but to say that we're healthy plant protein. Um, some of the folks, some scientists, especially there was a big study out of Brazil, and of course the trade association, the Cattlemen's Association, the Pork Council, the Dairymen's Association, they're having a good old time attacking plant protein as ultra processed. And there is, of course, some studies showing that in our new Health and Human Services Secretary is all about ultra processed food, and so it depends what someone's eating. Eating a Beyond Burger and eating a Twinkie are not the same thing, right? So when one does these studies, one has to look at individual products. When you're buying plant-based or plant protein, they have a lot of protein. You want to just take a look though and see if you're interested or concerned about how much protein you're getting. We'll get to that in more detail in a few minutes. Just look at the amount of grams of protein per serving. Um, you want, if you're young and healthy and don't have high blood pressure issues, you don't have to worry as much about sodium, but still it's good to keep your sodium down. If you eat too much sodium, your blood pressure is going to go up. It's going to damage your arteries and you're not going to live as long, or you're going to end up on high blood pressure meds. Saturated fat is just not good. And I would also add that as far as we know, and some vegan advocates will say otherwise, but it's not based on the science, that that plant-based saturated fats also are not healthy. The great majority of plant-based fat are are not saturated fat, whereas animal fat, much of it is. Um, Coconut, especially, and palm um, are very high in saturated fat. You'll see a number of plant-based sort of meat substitute products, and a lot of the vegan ice creams and so on that have a lot of coconut in them. And when you look at the saturated fat, it's crazy high in saturated fat. And I'm not telling you what to eat and what not to eat. This is, but about human health. Um, Saturated fat is saturated fat. It's bad. Um, um, you also want to look, at for plant proteins and also um, for plant milk products as well. You don't want added sugar. Um, um, and in general, you want to see um, what ingredients are included in these products. If it has back to plant-based protein or plant-based meat, quote unquote, if it has a list of 86 ingredients and lots of chemicals you never heard of, well, that probably isn't super healthy. I mean, RFK Jr. is right about that. If it has 10 or 15 ingredients and they all sound, like healthy stuff, it's probably very healthy. Okay. This is a statement from the Academy of the Academy of Nutrition and Dietetics, just came out well 2 months ago now. Speaks to vegetarian and vegan diets for adults. And so this is the professional association um, of dietitians in North America. Number one, nutritional adequacy. The Academy of Nutrition and Dietetics states that appropriately planned vegetarian and vegan dietary patterns can be nutritionally adequate for adults. And so this is a group that's not the biggest vegan fans in the world, and so they recognize and acknowledge that um, um, veg and vegan diets, can be nutritionally adequate. They clearly acknowledge that there are health benefits, particularly with cardiometabolic disease, which is what kills most of us. Um, they acknowledge chronic disease prevention and management, and while and they say more in the paper, that they like me acknowledge they're not environmental or climate scientists, they're nutrition scientists, but they note the sustainability benefits of plant-based diets. This paper is about adults. It didn't speak to children or pregnant or lactating women. Prior policy statements, and we'll get to a little bit more of that in a few minutes, do speak to the adequacy of vegetarian and vegan diets for pregnant women and children. And again, one has to be careful with any diet. All right, so let me sort of catch our breath here. I can't resist this slide, right? So, right, if you're vegan, you're hanging out with friends and family, and people are just interested or they're trying to harass you. The first question is, where do you get your protein from, right? So here are some of our um, um, animal um, animal beings that are fellow Earth travelers like we are, who nobody would suggest is lacking in muscle, and of course eats entirely plant-based diet. Now, every species has its own dietary needs. All right, so here's just sort of raise and answer some questions and myths. The last three I'd sort of put them in green because they're more sort of questions specifically about nutrition. But so the first question, again, to humans and gorillas and elephants and all the rest, a myth about a vegan diet is that there's not enough protein and it's not complete protein. So a few words about that. So if one's eating a typical diet in a, a country that's wealthy or a mid economic country and having some variety of food stuff, and it's all plant-based, and you eat 2,000 calories a day, you'll get enough protein. You always, always, always will. The only time you won't, you can get into trouble is if you're in a very poor country and you're eating sort of somebody's eating mostly corn, or most, that sort of thing. You can, but if you're eating a whole food oriented plant-based diet, getting enough calories. Again, this is for healthy people, not somebody who has liver or GI or renal disease. You get enough protein. So there's this myth about, well, not a myth, but there's this a little nuance about complete protein. So there are 20 amino acids. That's the building blocks for protein. 9 of them are essential, which means that for humans, which means that we can't produce them from a carbohydrate or other protein, so that we have to eat them to get them. When one eats animal meat, one is getting all 20 amino acids, including the 9 essential ones for humans. Um, most most plant protein is relatively lacking in 1 or 2 or 3 of the 9 essential amino acids, but it's all mixed up so that as long as you're eating a mix, and soy has them all, by the way, soy has all 9 essential amino acids. As long as one is eating a mix of different plant sources of protein, and everybody eats different plant sources of protein, you don't have to eat them all in one meal, just have to eat them over a few days. You're getting all the essential amino acids. So if you eat 2,000 calories a day, you're getting enough protein on a vegan diet. And if you're just having any reasonable variety of the plant-based protein sources, you're getting all the essential ones. All right, next myth. Vegans are deficient in essential nutrients. No, every diet, and I'll show you a table in a minute, every diet has some micro and macronutrients that are easier and harder to come by. It's true for vegan diets too. There are some nutrients, some micronutrients. Of course, B12 is the first on the list that vegans have to be attentive towards. And there are a number, people that eat all like keto diets, which are not healthy, almost all meat. There are nutrients that they'll be missing as well. So every diet has an adequate or an excess of some nutrients and deficient in other nutrients unless one is thoughtful and careful. Vegan diets are healthy. You just have to, be a little attentive to some micronutrients, have a mix of what you're eating. And again, if your vegan diet is, bear and Doritos and Twinkies, well, that's not healthy, obviously. But a whole food predominant plant-based diet, net is much healthier than the standard American diet. The people that eat that live longer and healthier. Are all vegans healthy? Well, no. You can eat an unhealthy vegan diet, and also, people get sick. There's lots of reasons to get a chronic illness besides one's diet, and genetics matters a lot. And so eating a healthy whole food plant-based diet for many of the diseases we're talking about, like cardiovascular disease, some cancers, type 2, stroke, probably reduces the likelihood of getting one of these diseases, depending on the disease, by a half, maybe 2/3 for some of them, but not by 100%. Genetics matters a lot. It also can delay the time that one gets these diseases. So, it's vegan, reasonably planned, thoughtful vegan diets are healthier than omnivorous diets. Nothing in this world's a guarantee. All right, totally switching gears to more of the social side of things. Vegans are preaching. Well, sometimes we get beat up about that, but I think also we get challenged because a lot of folks who aren't vegan are interested, and sometimes are projecting their own guilt from a health or from an ethical or sustainability point of view, and will ask obnoxious questions. They get obnoxious responses. But in general, if one is trying to get people to change, saying you're a bad person is not usually the way to get somebody to change. It's being supportive and aligned and collaborative, all those kind of things. So this is really a misnomer. Vegan is white, Caucasian. So in America, African Americans are 2 to 3-fold more likely to eat a vegan diet than whites. Latinos, and so when one talks about Latino and especially Asian populations, it's there's so many subgroups. It always strikes me when one talks about Asian Americans, that'd be like talking about European Americans, right? And so we aggregate for these public health numbers, probably based upon the predominant population group in this country, during when it was founded and much of its time, which is changing rapidly. We subsegmented whites more than other population groups. But having said that, for the population numbers I've seen, Asian Americans, um, whites, Latinos, um, um, are roughly equivalent in the amount of vegan diets. Of course, some subpopulations like Indian Americans have a very, very high propensity towards um, vegetarian diets, but very few are vegan. And African Americans are 2 to 3-fold more likely to be vegan than the other population groups. Um, all right. Switching gears on questions and myths. So the short answer is eating a plant-based diet healthy for pregnant women and children. Yes, one needs to be somewhat more careful. That is true, but it is healthy and can easily be done. Is soy healthy? Yes, yes, yes. Soy is very healthy. Soy has this gets challenged, has this misnomer. The soy, the organic molecule, organic chemical for soy is um, organic chemically looks somewhat similar to estrogen. It's not the same thing, but looks somewhat similar to estrogen. And so uh, there are these misnomers that both women who eat much soy will be more likely to get breast cancer, and men that eat a lot of soy will be more likely to get gynecomastia, get breast growth. It's not true. It's not true. There's lots of well-done studies that's basically, in professional terms, that's BS. I would add that so well-done study of um, rural Chinese women who grew up eating lots and lots and lots of soy and have a markedly reduced incidence of breast cancer compared to let's just say Anglo populations in North America and in Europe, markedly decrease. What's interesting and sad, but interesting, is Chinese who, and again, a rural Chinese who migrated to the U.S. who were eating a plant predominant diet with some meat for celebratory reasons, a lot of soy, very little dairy. Um, Within 2 generations, in America, unless one is choosing a vegan diet, have exactly the same disease pattern as whites that got off of the Mayflower. Um, so the population studies are interesting and sad, but huge. Soy is healthy. Soy is a really, really good source of many, many nutrients and of protein. All right, what about supplements? They're I'm trying not to it's an individual choice. Um, um, I mean, I take a multivitamin every day. It makes it a lot easier to make sure that I'm getting some micronutrients. Many of the sources of micronutrients that we say that are um, found in vegan foods are in vegan foods because they're fortified. So um, um, taking supplements, again, it all depends, but I think taking supplements, can be healthy. There's nothing wrong with that. I'll say a word about B12 in just a little while. Um, and I'm happy to answer more questions about it later, but I don't, if someone wants to be steadfast about never taking supplements, okay, that's fine. One has to be careful about a few micronutrients, starting with B12. Um, and again, noting that many vegan foods that we buy and that we eat are anything that's not, right off the vine, if you will, are like some whole food grains, some grains are fortified and for good cause. Okay. Oops. There we go. Okay, so to my not to go through each of these in detail, but to my comment about are vegan diets healthy? Do you get all the micronutrients? Well, here, just a quick list. So fiber is crazy important. You can't get fiber from animal products, only from plants. Fiber, fiber, fiber. It's important to get enough fiber. 95% of Americans don't get enough fiber. Um, it's way easier to get fiber in a vegan diet. Some vitamins, vitamin C, vitamin E, folate, magnesium, potassium, of course, and a number of antioxidants and phytochemicals. These are the circulating molecules that reduce inflammation and reduce the risk of cancer, heart disease, some other diseases, and prolong and enhance longevity. Now, having said that, it is true um, um, that there are a number of nutrients that are harder to get on a vegan diet. I'm going to come back to B12 in a minute. Vitamin D, calcium, say a word about iron, zinc and iodine to some extent, omega-3, yeah, vitamin A, a little, and I'll say a word about creatinine as well. So B12. So some vegans will say to me, "Well, I didn't have to eat B12, or our ancestors when they were living in nature." And then I'll say, "Well, you're living in Manhattan, you're living in LA, you're not living in nature." And so the plants you're eating, um, when one eats plants with dirt on the plants, right from soil, you get B12 from the bacteria. Because the animals that have B12, when humans get B12 from eating animals, from eating meat, it's because the animals are eating plants and eating dirt, and they're eating bacteria, and the bacteria are where the B12 is coming from. Having said all that, if you eat a vegan diet, please take a B12 supplement. Unless you're taking, eating a lot of nutritional yeast or the very few other sources. It's easy, it's safe, um, and it's a long, bad chronic illness to be B12 deficient. All right, so vitamin D is harder to get on a vegan diet. Um, um, and so one gets vitamin D from sunlight. So, you're all in California. I'm sitting here in Boston. I'm just starting to walk outside with shirt sleeves, right? Um, so I take vitamin D because 6 months of the year, I'm just not getting a lot of sun. Um, Calcium is complicated. One should be attentive to calcium. Um, it's not a one-to-one relationship between how much calcium one eats and how much calcium was laid down in bone. And of course, for men too, but for women especially, and particularly menopausal age and postmenopausal, osteoporosis is a huge problem. And one has to build up that calcium in bone over the preceding decades. Exercise, resistance exercise, crazy important, um, um, as well. Of course, vitamin D and phosphorus is important as well for calcium. Um, the plant-based milks, quote unquote, are good sources of calcium. There's leafy green vegetables and many others, but I do think being attentive to calcium is important. Um, it's not that hard to get enough iron from a vegan diet, but it is somewhat harder. Um, and so it makes sense to pay some attention to, especially here too, again, especially for children and especially for women of menstruating age for obvious reasons. Zinc and iodine, yeah, it's too bad. Iodine is supplemented in salt, which, you know, made sense 100 years ago, but in any event, omega-3 I take an omega-3 supplement. I probably don't need to because I eat a good amount of flax and hemp and chia seeds as well. But it's ALA is an omega-3 that's common in many plant foods, but it's hard for our body to convert ALA to EPA and DHA with the active anti-inflammatory omega-3s, and so if you're eating seeds and some other sources of omega-3, most days you don't need a supplement. If you're not, it probably wouldn't be a bad idea to take a supplement. Vitamin A is pretty easy to come by, and obviously some plants have a lot of vitamin A. Creatine is getting some play recently. It's our body makes some creatine. It can be ingested from animals, and if you're and some people think, especially for growing muscle mass, that taking a creatine supplement can be a good idea. The science is uncertain on that. So, and I could talk about these uh, micronutrients for hours, and won't do that, I promise. Uh, and I'll answer some questions later on, making the point that on the left, there are some micronutrients and fiber that are way easier to come by in a vegan diet. And there are some that are easier on a non-vegan diet, and one has to be attentive to. All right, moving along. This talk isn't about children, but I'm a pediatrician, so very briefly. This is a statement of the 2 slides, American Academy of Pediatrics, my professional association. I think I'll just read the first bullet. So this is a policy statement from AAP to pediatricians. Have parents who are vegetarian ask you if vegetarian diet is appropriate for their infants or young children. Again, it's easier for older children. How strong is the evidence? There's a well-known study in 2021, uh, longitudinal cohort study, nearly 9,000 children. Um, so, um, so omnivorous children and vegetarian vegan children, 6 months to 8 years, so little kids, were part of a primary care practice in Toronto. 248 were vegetarian or vegan. The rest were omnivorous, and were followed for at least 3 years. The authors looked to see if there were any growth, weight, height, iron, vitamin D, lipid issues in these children, the 248 that were followed for at least 3 years that are vegetarian or vegan, young children. And so the key bullet, the authors found no significant differences in growth between children on veg diets compared to non-veg diets, though the odds of being somewhat underweight when weight categories were stratified. So this was very careful. It's not a big issue, but they're being very thorough. Somewhat greater in vegetarian children. Of course, being to the left of the bell-shaped curve on weight, as long as one isn't underweight, is healthier, really. No increase or decreased association of veg diets and being overweight or obese. Ferritin is iron stores, so no differences in iron stores, vitamin D levels, or lipids. And so the AAP goes on to say that that for young children, and as carefully monitored, they would say by pediatricians or dietitians, vegetarian diets are healthy for children. And in the long term, we in pediatrics, when we know that our children become adults, write that down, and we know that our children, when they're 50 or 60 or 70, that many of them will die from heart attacks and cancers and strokes. But we're not caring for that. We don't see it every day. Internists, gastroenterologists, endocrinologists, oncologists, cancer doctors, adult doctors, they see it every day, so they're more sensitive. But children that start off in a veg diet are much more likely to stay in a veg diet. Their families, of course, are much more likely to be veg and to be healthier in general. So it's much, much healthier in general. So Nutrition for Families, a charity that I co-founded, and I'll show you the website, the hyperlink in a second. There's a couple of, if you're interested, a couple of detailed resources on plant-based diets for young children and school-age children. You can just go to the website and read it or download it. All right, winding down here. Why don't my colleagues do more about encouraging healthy nutrition? Well, we were never trained in it. It's true. Over time and around the world, docs aren't trained in healthy nutrition, very, very little, let alone plant-based nutrition. Change is hard for clinicians, for patients. Well, genetics, Darwin, we evolved from scarcity. That's why our ancestors, we have this DNA. We died, probably famine and plague, trauma, infection, leading causes of death until, the day before yesterday, right? And so having strong compulsion towards fat, towards salt, towards sugar is baked in the DNA. And so, physicians who have busy days and many demands, and sometimes feel like they're banging their heads against the wall. It's also easier for a doc to write a prescription or do a procedure than to give dietary advice. Lack of education, relative lack of resources, how to answer patient questions. There aren't enough dietitians around, except in specialty practices like a diabetes practice, a cancer practice, GI practices. You won't get to see a dietitian. And, most docs, don't have a lot of good personal stories to tell as well if they feel like doing that. So a lot of docs don't give a lot of support here. All right, and I'm happy to obviously to share the slides. So this is too much to write down all at once, but so I'll send the make sure that everybody has access to the slides as you see fit. So Dharma Voices for Animals is not a nutrition NGO. It is a faith-based. It's the world's only Buddhist charity that speaks to vegan diets and speaks to animals and animal suffering as its core. I'm proud to be a member of the board and to support the organization. And Physicians Association for Nutrition is a very good resource. Nutrition for Families, which is about pediatrics, lifestyle medicine, I mentioned. Nutrition Facts is Michael Greger's charity. Blue Zones, we talked about. Harvard and many Mayo, many other places have good nutrition guidance. Physicians Committee for Responsible Medicine and Plant Nutrition Project are two good physician, plant-based, American-based charities. Balanced is a charity I've had some association with and does public health on an institutional basis, supports schools especially and other institutions in being more plant forward and having plant-based choices. And actually, and I would add that Balanced has partnered with Dharma Voices for Animals, with DVA, to work with Buddhist centers on because a lot of times we'll come across centers that want to have more plant-based choices. I mean, not for me to say, but for our faith-based leaders to speak to the issues around ahimsa and the issues around not harm for all sentient beings from a practical and from a human health point of view. A lot of the centers will say, we just don't really know how to make vegan food to scale. And so Balance partnered with DVA to support DVA in recipe guidance. Wholesome Wave is a charity that works especially on plant-based diets for underserved and impoverished populations. All right, that's me. And the relevant associations, DVA again, and so I have a bunch of emails with different charities. But if you want to reach out to me, the easiest way to get me is just Alan at dharmavoicesforanimals.org. Easy to find on LinkedIn as well, and so on. All right, Q&A. That's my talk. Let me end the screen share.
Thank you, Alan. That was awesome. Really appreciated that.
Are.
It was really good.
All right. I hope that was interesting and helpful to some of us here. So I know that was it was a sort of a 101 cursory overview kind of talk. So there was a lot there. So I'm happy to answer any questions if anybody has any. Czar, please.
Thank you so much. First of all, thank you so much for your time. And I wanted to see if you could please speak about calcium and iron, because I hear that it's best not to take calcium supplements and iron supplements as a vegan. If you could just give us.
Yeah, no, and it's complicated, and nutrition research, there are different studies that say somewhat different things. So there are some studies, not necessarily on a vegan population, that show that taking calcium supplements is unhealthy and perhaps increases the risk of cardiovascular disease. Not obviously it doesn't increase the risk of bone disease. It's these studies are hard to control. I think that so around calcium, it's a definite maybe. I think I would add that unlike B12, where it's really hard to get enough B12 from a vegan diet, with calcium, it's not that hard to get enough calcium. It's not. So that there are many good sources. All the legumes are great sources, green leafy vegetables. And I do suggest so in terms of a sort of a safe way to not supplement but to fortify, and there's no evidence that this is a problem. the plant-based milks, some of them, will have 25 to 35% of the RDA, the recommended dietary allowance, for calcium in 8 ounces. So if you have, 1 or 2 glasses of a plant-based milk, that takes it from being a little bit hard to really easy to get enough calcium during the day. So that's what I recommend. I also would recommend, and I'll get to iron in a second, I would add that around calcium. Sorry, about plant-based milks. There's a bunch of different products, and so you got to look in the label, so that only 3. While I made a point earlier not to go all crazy about protein, certainly if one is being attentive to enough protein, or for children, or for seniors, or for people that are very athletic, some of the soy, flax, and pea milk have a decent amount of protein, and the others have almost no protein. Beyond that, I'd look at the label and make sure that this calcium supplementation, there's not a lot of sodium. A little bit of sodium's fine. There's not added sugar dumped into the plant-based milk. So that's what I would suggest on plant-based milks. But having that, with your oatmeal or cereal in the morning, or with a smoothie, or is a good way to bump up calcium safely. But I don't and would not recommend taking, for otherwise healthy person, vegan, taking calcium supplements. Iron, so iron is, you can and should be able to get enough iron from a vegan diet. There's no doubt about that. It if for again, for too much iron can be unhealthy. So that, and there's some evidence that if someone has too much iron, that cancer cells are sort of iron or ferrous or phoric, and so there's some evidence that if one's circulating serum iron and the iron binding proteins and so on are sort of high normal or high-ish, that may, some of this is theoretical, may raise the risk of some cancers. It's probably, for those of us that see a doc every year, every couple of years, again, this is a bigger issue for women who are menstruating. It's not a bad idea if you're vegan to besides the CBC, a blood count, to have, you don't have to have all the clinical language here, but to have the doc, order iron studies and just make sure that your total body iron stores are adequate. If they are, the diet you're eating is fine. If they're not, taking 12 to 18 milligrams a day of an iron supplement, there are vegan iron supplements, is probably just fine to do. But one ought to be able to get enough iron from a diet, again, from legumes, green leafies, and some of the seeds and so on. Did that answer your question?
Yes, thank you.
Okay, welcome. And again, I probably have beat this way too hard, but if you are vegan and you're thinking about one supplement, just do me a favor, get B12. B12 is different, and one will be B12 deficient without taking the B12 supplement.
Oh, thank you so much. I think I just had a question. Well, Alex and I, we get our blood work.
Oh, I'm sorry. Yeah. Go ahead. Yeah.
Can you hear me? Yeah. Alex and I've been vegan for 17 years and stay on top of all of the nutrition facts and eat a wide variety of plant foods and whole foods, plant-based. And our doctor says we're the healthiest patients she sees. We eat popcorn every night with fortified nutritional yeast, and our B12 numbers are almost too high.
Yeah, that's great. Yeah, that's great. So,
but last year I ended up with thyroid out of whack. I run and lift weights a lot, and I was really suffering from pretty extreme fatigue. And I started taking an iodine supplement because I don't like seaweed, and I don't drink plant milks because they got too much sugar in them. So, is that something you've seen before? With I started taking the iodine, plant iodine, and I started feeling better. So I've just thought that must have solved it. But anyway, that was an odd. And I had my thyroid checked again, and it was fine. So I don't know what
Well,
your
then
thoughts
it's,
are.
yeah, I mean, because we know each other, but, the usual comment that any physician makes in any of these sort of settings is, I'm not giving medical advice and just making general comments, and, that's between you and your doctor and all that, right? So I would add, though, that there are several different causes for thyroid disease, right? And so not all of, and iodine deficiency is only one of the number of causes. So, so, um, so it would have been, so if your iodine level was low, and if your thyroid level, your T4 was low, if your T4 was low, your THS was high, your iodine was low, you probably weren't getting enough iodine. And so, I and it is relatively hard to get enough iodine on a vegan diet, and so one wants to, I'm not a purist here at all, and many of my vegan friends and colleagues are, sort of more reluctant to take supplements than I might be, and so I would add that the reason why, um, so for example, and so I'm sort of rambling on here, but to go back to B12, so you know, um, because it's put in the nutrition in the yeast, right? So that lots of the reason why vegans are able to get adequate levels of some micronutrients is in part because of eating fortified foods. Not the only reason, of course, many of the micronutrients come from eating the foods themselves, from whole food plant-based foods, but that fortified foods are really not that different than supplements. And so, um, taking an iodine supplement is easy to do. The seaweed root is hard for most people to do. There's iodine in salt, but I never want to recommend just dumping, a lot of salt into one's food. Um, and so I have found for me, and I've been vegan for 35 years, but I'm sorry, I've been vegetarian for 35 years and vegan for 28 or so, but I'm old. Um, a lot of years of not being. So, I take a multivite, and I don't have to worry about it. So I may not have answered your question, but that's hopefully I touched on part of it.
Yeah, that was great. Thank you. Yeah,
Okay.
we take a DHA algae oil, D3, an iodine supplement, and then we eat nutritional yeast. So those are
Yeah,
the
that's great. That's
yeah,
really, you're good to go.
yeah, those are the main micronutrients that and those, like you said, I think the one thing you said that I liked also, we said a lot of stuff, but the deficiencies you get on a keto diet. Oh my God, this was like off the charts. No fiber, a lot of other micronutrients. But Margaret had a question about creatine, and I'm interested to hear about that too, because as a personal trainer, I have taken creatine off and on during my vegan life, and I'll be curious to hear what your thoughts are about that. I have taken that for muscle growth and stuff. So
Yeah, I must say I've just in the last few months started taking creatine, and so I don't. The research is equivocal. So okay, so point one, creatine is obviously is useful. It's critical for muscle mass, as you know. Um, it's much easier to get enough creatine if one eats animal muscle. So not advocating that, just describing that. Um, our body makes, so creatine, while not an amino acid, is not essential. Our body makes some creatine, but it doesn't make a lot or perhaps enough if one is consuming none of it. Um, the 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 studies, so if one looks at, there just haven't been enough good studies. If one tries to do is so looking at somebody who's measuring the amount of resistance that one can handle, and does creatine um, enhance one's strength, um, um, and the research is equivocal, and so one really, some studies say yes and some say no. So I really don't know. It seems like it's probably reasonably important. It seems like it's probably benign to take supplements, so I just started doing it. And again, it's some of these comments also, um, it's nutritional research is very hard. It's not like doing physics in a laboratory, and so a lot of the studies can be conflicting um, or equivocal and so on. So I just started taking it myself.
Margaret, I saw you had a question. I could just share with you. I had, I guess it was around the same time I had the, no, it was a year after that. Anyway, I had my creatinine levels were crazy low when I got my blood work. And I asked my doctor, and she says that's probably actually good because creatinine is a byproduct of eating. People that eat a lot of meat have higher creatine levels. Also, with that comes inflammation and other stuff. So I was asking about it, and she said, you don't need to worry about it. But I have taken creatine off and on. I can't tell if it's a placebo effect. I know the power of placebo with my workouts. It does seem like it helps sometimes, but then I also have to urinate a lot more when I take creatine, which means it could be possibly overworking my kidneys. So I don't stay on it for too long when I do take it. But I don't know, Alan, if you have a thought on that. I definitely
Yeah, I do. I mean, I don't know about the increased urination. I do. I mean, for me as well, when I started taking it, it's probably confirmation bias, the placebo, but it felt like I was doing a little more on the weights. But that's not a randomized controlled trial. Creatinine levels in the serum. So when diet aside, when physicians measure renal function, the the first two, so obviously one checks the urine, but the first two blood tests are called BUN and creatinine. And unless one studied this, it's a little bit nuanced and complicated. But higher BUN and creatinine can be evidence for decreasing renal function. Um, um, Creatine, when one eats creatine, one is likely to have a somewhat higher serum creatinine level, but that doesn't mean that is damaging their kidneys. So if one eats the same amount of creatine every day their whole life, and their kidney starts to fail, their creatinine level in the serum will rise. So I'm not sure. I'm not sure that what your physician said. I mean, it's your kidneys are fine, but is that evidence of lower inflammatory, within your body? I'm not sure that's right.
It makes sense. Yeah. And that might have been just my tying some different things together. I'm not sure. I think my physician just said your low levels are probably fine. So
Yeah, no, I do. Yeah, so I don't think that's a big problem. I mean, it's probably. I mean, if someone has I would add though that if someone has early onset renal disease, or certainly somebody has real renal disease, then they really should talk to their doc about that, and about creatine. But creatine and obviously one would check serum levels, before and after and all that. But for an otherwise healthy person, I don't. It will raise the level a little bit, but I don't think that's any evidence for inflammation or renal disease.
Margaret, did we answer your question there? Cool.
Good. Okay. And again, some of my answers are, I wish that some of these answers could be shorter and yes or no, but you're asking tough questions and nutritional research is as I think everyone knows the gold standard in clinical medical research is a randomized controlled trial. And so there's sometimes double blinded, so the doc or the patient. So there's no way in the world to take a population of people and randomize them to diets and have them not know what they're eating and their doctor not know what they're eating, and follow them for 5 or 10 years, right? I mean, you can do that with a drug, but you can't do that with diet. So that doesn't mean that the nutritional research isn't accurate and useful, but it does mean it's nuanced and more complicated. I would also add one other comment. When some folks who want to attack all nutritional research, saying, well, it's not randomized controlled trials, my sort of snarky response is, so how many randomized controlled trials have there ever been to show that cigarette smoking causes cancer? And the answer is zero.
Yeah.
And that's unequivocal, of course. So well done studies, repeated studies, many studies looking from different angles over time, one can come to thoughtful, logical conclusions. It's just a little messy to get there.
Yeah. That's great. Well,
Yeah.
thank you so much, Alan. Does anyone else have any questions or comments, or anyone want to say anything before we let Alan go to bed? It's getting late on the East Coast.
Yeah, awesome. Well, and I'm jealous that you all can get your vitamin D level without supplements a lot easier than I can, right?
Yeah. Well, Alan, that was great. Thank you so much for coming out tonight, and thank everyone else that attended. And I'm Forrest. I'm with DVA also, so I was just kind of helping facilitate the after bit. But yeah, thank you, Alan. And
Pleasure.
Super helpful.
question,
Seeing
yeah.
everyone. Yeah.
Thank
Happy
you.
to be here. You're very
Super
welcome.
helpful.
Great. Take care. Thank you. Bye now.
Okay, thanks, Alan.